You walk into your pharmacy. The pharmacist says, "Let's discuss whether this vaccine is right for you." Sounds reasonable, right? But here's what's surprising. Nearly half of Americans have no idea that this conversation is supposed to happen for certain particular kinds of vaccines. And that gap, well, seemingly it's costing us. Researchers surveyed over 900 people in Alabama about vaccines that require something called shared clinical decision making. So these are vaccines where you're supposed to actually discuss with your provider whether you need them rather than just going to get them automatically. Think about things like HPV vaccines for adults, certain pneumonia shots, RSV vaccines, those kinds of things. And the researchers asked, do you know these discussions should happen? Would you participate if asked? And crucially, do you trust your pharmacist enough to have this conversation with them? I think that the patterns that emerged from asking those questions were pretty striking. Here's what they found. Trust in pharmacists doesn't just make you feel warm and fuzzy. It fundamentally shapes whether you'll engage in these vaccine discussions. People with higher trust were 78% more likely to participate. But trust is something else. It also changed what people wanted. Those with lower trust said, well, I'll decide for myself. Those with higher trust said, let's decide together. Or even, well, you have the expertise, you decide for me. And the researchers also found massive disparities between particular social groups. So black participants were 50% less likely to engage than white participants. Republicans less likely than Democrats. People without high school diplomas far less likely than college graduates. So we get different response rates and different kinds of response across these groups. And that gap isn't just about awareness, it's about trust. And as we're seeing, that trust isn't evenly distributed. Your willingness to have a potentially life-saving conversation about vaccines really depends on whether you trust the messenger. And that correlates really powerfully with race, education, politics, past experiences, and so on. So this is not just a knowledge problem that we're facing a trust gap that's disguised as a healthcare recommendation. All of that said, what can we do? Well, if you're eligible for vaccines requiring a shared decision, don't wait for your pharmacist to bring it up. Ask directly. And I guess also if you're a healthcare provider, know this, your communication skills matter possibly more than you think. Show that you care. These aren't soft skills. They really are the difference between someone protecting their health and someone walking away unvaccinated. So build trust before you need it. Because when it comes to shared decisions, trust isn't optional. It really looks like it's the whole point.